start with chapter 47 and then move on to 50, and then hopefully there's time to do some math review in class. So we're all on the same page with math. Okay, so first and foremost, gastric cancer is where we're gonna start today. One of the things about where gastric cancer can be located is anywhere in the stomach that penetrates through the walls of the stomach, and it can go to the liver, pancreas, esophagus, and duodenum. So it occurs anywhere in the stomach that penetrates through the walls of the stomach to the liver, pancreas, esophagus, and duodenum. One of the clinical manifestations or signs and symptoms is early stadia, or however you'd like to pronounce that. That means fullness. They get early fullness when they're eating. And that's truly because the gastric cancer takes up that area, and that's why they feel full. So assessment-wise, of course, intake, what are they taking in, is one thing that we'll find out with assessment. They've had any weight loss, any foods, meds, or that makes the pain worse. So do they eat anything, or do they have any medications that cause worsening pain? And then any changes in their eating habits as a whole, and then any change in appetite. They have any changes in appetite as a whole. So that's where we would start with assessment. Diagnoses are there for you, planning, and then anxiety is one. One, of course, psychosocial, and then promoting optimal nutrition, some other helpful hints that are in those bullet points I'm not gonna read, you guys can. Biggest thing about promoting optimal nutrition with these patients is small frequent meals. Just like we tell our diabetics, but small frequent meals, non-irritating foods, so no cabbage, no spice, no tomato sauces or anything with acidity. Then other interventions, of course, would be pain control. So when we're talking about assessment as a whole, again, just some things that we have to hit on is the knowledge, patient's knowledge and family knowledge of the disease process as a whole in order to get them in the optimal health, and then preventing any complications that we're associated with patients that have gastric cancers. So complications such as hemorrhage, dietary deficiencies. One of the biggest dietary deficiency is iron. So iron anemia. So how we would know if that patient has iron deficiency anemia, they have fatigue, shortness of breath, get winded on excursion when they walk, just to name a few things. And then B12 is also a dietary deficiency because of course, the gastric region, and that's where those vitamins absorb from. One other thing is bioreflux that they experience with gastric cancers as a complication. So what they need to take is a biobinding drug, generic name, cholecystramine, which helps to remember. Choline just looks like gallbladder. So that is your biobinding drug association with that bioreflux. And so that's a medication that they would need to be on for bioreflux. Another complication is dumping syndrome. Patients experience dumping syndrome, also those who had gastric bypass. So it's similar, where it looks like with dumping syndrome, they have hypoglycemia, but their blood sugar is actually elevated. And so what happens is, it's a rapid passage of carbohydrates, high intake of carbohydrates, and a high intake of electrolytes. And so the signs and symptoms, like I said, look hypoglycemia. So they get diaphoretic, agitated, and dizzy, weak. They have overwhelming warmth, so that diaphoresis that comes along with that, and then drowsiness. But again, that blood sugar is increased, it's not decreased when it comes to dumping syndrome. So interventions-wise, again, pain control, of course, is the key. High Fowler's position, and then it might have to be patients with gastric cancers that would need an NG2 to help regulate the acidity and maybe even the bioreflex until we can get this particular drug on board with that. And then, of course, the malabsorption of vitamins and minerals in association with the deficiencies that they have. So another thing that they experience too is fatty stools, and that is a fancy word for fatty stools. And so lopamide or lopramide would be your drug of choice to help with that diarrhea, that fatty diarrhea as a whole. So dietary self-management, here's the recommended dietary self-management for patients with gastric cancers. Again, as a whole, we want to make sure small frequent meals associated with anything else that is mentioned above there. Keeping in mind, we want to make sure we protect them too from that dumping syndrome, etc. Questions about any of that with gastric